Why is female infertility diagnosis so difficult? Imagine trying to solve a puzzle where each piece could be hiding in a different room. That's what diagnosing female infertility can feel like. The female reproductive system is incredibly complex, involving the ovaries, fallopian tubes, uterus, and hormonal signals. For conception to happen smoothly, all these parts need to work together perfectly. But problems can occur in any of these areas, and often, symptoms are subtle or overlap with other conditions, making it hard to find the exact cause. One big challenge is that there are many potential reasons for infertility. It could be ovulatory issues, where the ovaries don't release eggs properly. It might be blockages in the fallopian tubes preventing eggs and sperm from meeting. Uterine problems like fibroids or scar tissue can interfere with implantation. Diminished ovarian reserve means fewer or poorer quality eggs, which becomes more common with age. Hormonal imbalances from thyroid issues or prolactin disorders can also play a role. And conditions like endometriosis, which causes tissue similar to the uterine lining to grow outside the uterus, can damage pelvic organs and cause pain, but sometimes women have no symptoms at all. Identifying which of these is causing infertility requires a detailed and systematic approach. Symptoms can be very misleading. For example, endometriosis often causes pelvic pain, but it can also be completely silent. Hormonal problems might subtly disrupt your menstrual cycle without obvious signs. Because these issues overlap, a single test rarely provides the full picture. Instead, doctors need to gather a comprehensive history, including menstrual patterns, previous surgeries, sexual health, and lifestyle factors. They then perform physical exams focusing on the thyroid, breasts, and pelvic area. The next step involves a series of tests. Blood tests check hormone levels like follicle-stimulating hormone, luteinizing hormone, anti-Mullerian hormone, and others to evaluate ovulation and ovarian reserve. Imaging tests such as transvaginal ultrasound help visualize the ovaries and uterus. Sometimes, a hysterosalpingography is used to see if the fallopian tubes are open. If these tests don't reveal the cause, more invasive procedures like laparoscopy may be necessary. During laparoscopy, a small camera is inserted into the pelvis to directly observe the organs, which can uncover endometriosis, adhesions, or tubal damage that might be missed on imaging. Non-invasive tests have their limitations. For example, ultrasound can't always detect small endometrial lesions or deep adhesions. Hysterosalpingography can show if tubes are blocked but doesn't reveal the cause. Sometimes, the only way to definitively diagnose endometriosis is through laparoscopy, which is a surgical procedure requiring anesthesia and recovery time. Additionally, ovarian reserve tests like anti-Mullerian hormone levels give an estimate of the remaining egg supply but don't assess egg quality, which also declines with age. Hormonal fluctuations add another layer of complexity. Because hormone levels change throughout the menstrual cycle, timing of blood tests is crucial. A single measurement may not accurately reflect the overall hormonal health. For women with endometriosis, diagnosis can be especially tricky because the disease can coexist with other fertility issues. It often requires careful evaluation and sometimes surgical confirmation. Lifestyle factors like stress, body weight, and nutrition also influence fertility but are harder to measure and interpret. These factors can affect hormonal balance and ovulation, further complicating the picture. Because of all these variables, diagnosing female infertility isn't a straightforward process. It requires patience, a personalized approach, and often multiple steps to piece together the full story. In summary, the difficulty in diagnosing female infertility stems from its multifaceted causes, subtle symptoms, overlapping conditions, and the need for various tests, some invasive, that must be carefully timed and interpreted. Each woman's situation is unique, which is why working closely with healthcare professionals who specialize in reproductive health is essential. They can guide you through this complex process and help identify the specific factors affecting your fertility. Always remember, Accurate diagnosis is the first step toward effective treatment and achieving your family building goals.